Top of the morning, Dan and Amy. Earlier in the week, we were talking about this boorish and sometimes violent behavior by pro-Hamas protesters on college campuses. We talked a bit about the tribal politics that what you see is illustrative of on college campuses. And VDH, Victor Davis Hanson from the Hoover Institution, had a good riff on this, tribal politics, and folded in a quick commentary on these quote-unquote elite schools, not just the Ivy League, but places like my alma mater that have descended into madness yet again as well.
We've never been in this territory. We have 55 million people who were not born in the United States. That's the highest number in our history and the highest percentage. Almost 15% with the latest 10 million. We don't authenticate them. We don't do background checks. We don't even try to integrate and assimilate them. So they are tribal. We say your tribal fides, not your American or your shared residence, is what counts. And then we shouldn't forget this diversity, equity, and inclusion. It's really pernicious in two ways. It says that if you're so-called non-white, you can't be discriminatory, you can't be racist, you can't be anti-Semitic, and the world is divided into oppressors and oppressed, and the Israelis and the Jews are oppressive white people, and therefore you get a complete pass to say whatever you want. And the second aspect of it is we don't even have the SAT anymore to go to these elite schools in most cases. And Yale gives 80% A's. The rest of the Ivy League is close behind. These students are not taking rigorous courses. They have plenty of time. They're gut courses. And these universities are intent on racing to the bottom because they're letting in students by their own admission would never have been admitted according to their own standards just 4 or 5 years ago. And now the students are running the university and they determine the grade policy, the types of courses that are offered, and they're in control, and the presidents are terrified of them.
Yeah, and so are the professors, and maybe they should be because everybody else is, and so nobody has their back. For example, just thinking about med schools, although it wasn't a med school course, but it's the course that you need to do well in order to have a realistic shot of being a good doctor. Talking about a couple years ago, it was Maitland Jones, Professor Maitland Jones at NYU, who had a renowned organic chemistry course that was difficult. Organic chemistry is difficult to begin with, he had a reputation, but he'd been there for a long time, and it was sort of a weed-out class. Right. You want to go to med school, you pass Maitland Jones' organic chemistry class, or you do well in it, and you're on your way. You don't, you're probably not, and this is the moment.
Well, you need rules in place for a reason.
Yeah, he got fired.
Why?
The course was too...
Oh, that's right.
We talked about it. The course was too tough. Too many people were failing, to Victor Davis Hanson's point. And by the way, where does this come from? Well, it comes from increasingly where they go to grade school and high school, even if they're going to, elite private schools that mommy and daddy are paying for, because those elite private schools, just like many of the government schools, have decided to reduce the standards, to dumb it down. There are consultants circumnavigating the country with programs. Good, Real Clear Investigations piece this week. Grading for Equity. This guy, Joe Feldman, Equity Grading Booster, Crescendo Education Group. He is pitching his wares across the country. Dozens of districts from California and Massachusetts are giving the project a shot as schools face a series of crises, including a spike in chronic absenteeism and sharp academic decline. Grading for Equity offers a path to better grades and higher graduation rates. Its practices include the removal of behavior in calculating grades, the end of penalties for late assignments, allowing students to retake exams, and a ban on zeros as the lowest mark. So as we have seen the test, via the test scores, the proficiency in reading and math declined since the school lockdowns. One of the ways to reverse that decline is just make grading more lenient. It's sort of a shortcut, isn't it? But consultant Feldman says the practices he promotes matter of fairness and accuracy in an educational system that's stacked against blacks, Latinos, and other disadvantaged students. Well, yeah, just give everybody the same grade, whether or not they can do the work. Well, problem solved. That's one way to go about it. For more on the topic, we're pleased to be joined by Dr. Sally Satel, psychiatrist, lecturer at Yale University School of Medicine, and a senior fellow at the American Enterprise Institute. Dr. Satel, thanks for joining us again. Appreciate it.
Thank you.
Yeah. I mean, I always reference Stanley Goldfarb because it seems to me he's been a medical professional who's been writing about this and speaking about it publicly, perhaps the longest. The continued dumbing down, not just through grading for equity consultants like Mr. Feldman that was profiled in the Real Clear Investigations piece, but what we're seeing continue at med schools too. In fact, you wrote about the Harvard-affiliated med school that's doing the same, engaged in other bad practices in service of DEI as well.
Yes. This would come under the category, I suppose, of identity politics in medicine. And surgeons and pilots are probably the two classes of people that everyone wants to make sure really know what they're doing. But this specific example has to do with a new policy at Mass General Brigham Hospital, where they were alerted to the fact that black expectant moms and black mothers that had just given birth were more likely to be tested for drugs, illicit drugs, cocaine, heroin, and reported to Child Protective Services. And this is very serious business. The reason this caught their attention was because not necessarily was this a bad policy. In other words, were we too quick to report? Were we too quick to maybe test without consent? Which are things you want to be careful about. And you certainly don't want to scare women away from prenatal care if they think they're going to get reported because they're struggling with a drug problem. But the real problem here is that it was the racial imbalance that was the problem, not the clinical considerations. And so they changed their criterion for testing so that the threshold would be higher. In other words, that the mother and or the fetus/baby would have to be in imminent distress or suffering injury at the time, and that's probably too high a bar. You don't want to wait till things get that bad. But again, the point is this is a very hard problem. No one has a good answer. All states treat this a little differently. They have different thresholds. Individual hospitals have different thresholds. But you want to find the best policy based on, what's best for patients, again, based on clinical factors, not to even out the scales, because drug testing shouldn't be equally applied across groups. It should be driven by the circumstances of each individual patient.
Mm-hmm. Well, I mean, this is, sort of not exactly on point, but the story out this week about the EEOC going after the Sheetz convenience store chain for doing background checks on prospective employees because they, why do you do a background check on a prospective employee? You want to know if they have a criminal history. Well, disproportionate share of people applying with a criminal history were minorities, so this is some EEOC violation, even though the EEOC does background checks on prospective employees to the EEOC. And so, I mean, it's also sort of the hypocrisy that just sort of rolls downhill, if you will, when it comes to these sort of race-oriented philosophical protocols.
Right. It's what you were saying before, which is if there are differentials in a test, don't have the test, like SAT. And in this case, the test is for drugs. And the thing is, I'm a psychiatrist. I work in a methadone clinic. We have women who are pregnant in the methadone clinic, and not always, but many times the babies need to be detoxed. The hospitals are actually very good at that because they're born with what's called neonatal abstinence syndrome. And basically, their little babies are withdrawing. They're not addicted. Little babies cannot be addicted, but they can go through a very stressful period of withdrawal because they have basically, been bathed in the the drug that the mom's taking for, quite a while. But doctors are very good at doing this. The real issue is that then if the mom is still using, and I mean using heavily, that then this little baby has to go home with a mom who's probably not going to be that attentive, probably not going to follow up with, postnatal visits and baby checks and all this kind of thing. And that's why Child Protective Services sometimes gets involved. But there should be, and there is in most states, a kind of a high bar for getting Child Protective Services in there. And some states, I say, and I do not agree with this at all, actually criminalize drug use during pregnancy. And that's not the way we want to go. You want to get these women with their little babies into drug treatment programs, often residential programs, and those can be just wonderful. They teach parenting. They help mothers get clean. Most moms do not want to have a drug problem while they have a newborn or while they're pregnant. They don't, but they're lost and they're desperate and they don't know how to stop. And that's the attitude we should have. Not we're going to catch you, but we're going to help you. And I think we could probably be better, we as a profession, maybe a little better at communicating that message. But we shouldn't look the other way, which is, a potential problem here with raising the bar so high.
Well, it seems to me there's sort of two buckets here. One is, are we training medical professionals to be experts in their fields? And then two is, are we allowing them to apply their expertise? So the issue of proper reporting that you're describing is applying expertise based on the circumstances. But then there's another story out of UCLA is about the training that's occurring or not occurring. And Aaron Sabarium has the piece, and it's about a public health class at UCLA Medical School that seeks to educate, quote unquote, prospective doctors that the problem, obesity is not the problem. Fat phobia is the problem. And weight loss is a Sisyphean task. Don't worry about weight loss. Worry about combating fat phobia, for example.
Oh, yes. I mean, these stories now are rife, and Aaron's doing a great job of documenting them. And I follow them very closely as well. And it's not even the physicians who are teaching physicians. I mean, there's so many problems. And one of them is they bring in these outside, really non-professional advocates, and they're the ones that are teaching the medical students some of these courses, and in intersectionality and implicit bias and concepts. In fact, the implicit bias concept is real, which is to say some unconscious attitudes that people carry around all the time. I mean, we all do. The question is, when you test for it, and there is something, sort of a way that's construed as a measurement of this implicit bias, that it has any kind of predictive value of how you treat, in the case of medicine, how you would treat another patient. And that has been completely dismantled by serious social psychologists and have replicated their work that there is no predictive value. So that they're even teaching medical students the wrong thing. So that's a huge problem. Another question is, what are they displacing? What are students not learning from true professionals when they invite these, frankly, second-rate mediocrities to expose them to these, social justice jargon? So I worry very much about the quality of training. I've also seen examples where certain conversations can't be had honestly. One example is these health disparities, which are real. There are certainly differences in health outcomes that correlate by race or group, and use of certain therapies that differentials in that. These are all true things. But the first question you ask is, why is that the case? You don't jump to the explanation that it's racism or systemic racism. That's just, at the very least, that's just not scientific. And even if it is, I mean, because when people talk about systemic racism, they talk about it's a fairly loose concept, and I think I'm not saying it's not a legitimate concept. When you connect the dots, in other words, folks who, like, let's say Black Americans, sure, they were very incredibly, obscenely disadvantaged decades ago, and there are still reverberations today, from that in socioeconomic terms. That's all true. But then the question is, so what are doctors supposed to do about it? And the answer is not raise the threshold for testing, pregnant women.
Doctor?
You have to go.
No, yeah, go ahead. I appreciate it. But Dr. Sally Satel is a psychiatrist, lecturer at Yale University School of Medicine, senior fellow at the American Enterprise Institute. Dr. Satel, thanks for joining us. Appreciate it.
Oh, thank you. Bye-bye.
Thank you. And she joined us on our turnkey.pro answer line.
There's only one radio show in Chicago talking about today's biggest stories and telling you what they really mean. That show is this one, Chicago's Morning Answer on AM 560. The Answer.
Worried about inflation, digital currencies, political turmoil, and the future of your investments? It's time to take control with Conservative Wealth Protection Group. During these times, central banks are buying gold and precious metals at record levels. But the question is, are you? With access to the cheapest bullion in the nation, we have a deep understanding of the precious metals markets. We'll reveal strategies that both the wealthy and everyday patriots just like you are using to get the most out of their tax-deferred retirement plans. With an A-plus rating from the Better Business Bureau, we provide guidance without high-pressure sales tactics. Our no-fees-for-life